What are the benefits, doctor, of skin grafting? The benefits are that grafting covers a vulnerable area. Doctor, that is an area that has lost its skin and reduces the risk of infection. Is that true? No, it is to reduce pain by covering exposed nerve endings. Doctor, may it also improve the cosmetic appearance of the area? Yes, it may. And what are the risks? Well, as far as I am concerned, and as well as the general risks associated with surgery and general anesthesia, you may develop infection at the donor or recipient site. Does infection, doctor, at the recipient site mean the graft may fail? No, it is merely an infection at the donor site that may impair healing. The donor, doctor, site may develop unsightly scarring. That is true. Or show changes in skin pigmentation. That is right. Or hair development. Yes. Doctor, are there any alternatives? Synthetic skin substitutes are available for temporary wound coverage to help reduce infection and fluid loss. Well, doctor, grafts obtained from cadavers or pigs can also be used as temporary biological dressings to stimulate granulation tissue formation. I disagree with your statement. Doctor, they are eventually rejected, however, are they? Well, usually within 10 days, unless immunosuppressant drugs are taken and are then removed from proceeding to skin grafting. Doctor, is it not true that skin grafts may be growths in a culture from a patient's own harvested skin cells? That is true. And these cultural epidermal autografts, doctor, only contain what? They only contain epithelial cells and are usually very thin. Doctor, they have a higher rate of infection, do they? Yes, also of graft loss than normal skin grafts which contain a part of the dermis. Dermal grafts, doctor, that do not contain any cells but which act as a scaffold on which cells from underlying tissue can grow through, are available, however. Is that not true? Well, I would say that once these become revascularized over a period of 7 to 21 days, an ultra-thin, shallow, split thickness graft or a cultural epidermal autograft may be placed on top. What can I do, doctor, to prepare? Try to ensure that you are as healthy as possible. What does that mean, doctor? Eat a nutritious diet and maintain a good fluid intake to ensure your tissues are well hydrated. If you smoke, doctor, is that bad? You do your utmost to stop. Do some surgeons postpone or even cancel the operation if they are unable to get the patient to refrain? That is so. And from smoking for at least 6 weeks before and 6 weeks after surgery, is that true? Yes, it is, because this reduces the chance of the graft taking. 2 weeks before surgery, you may be asked to discontinue taking certain drugs and herbal remedies, especially those that may increase bleeding time. What if I don't have the operation, doctor? What happens then? Areas of the body that are not covered with skin will soon become infected. What happens, doctor, during the recovery period? Where possible, a compression dressing is applied for 24 hours to keep the skin graft firmly in contact with underlying tissues. Doctor, is it not true that the part of the body with the graft is kept elevated after the operation to reduce oozing that might separate the skin from underlying tissues? That is absolutely correct. And if the graft is below your knee, doctor, you will not be allowed to put your leg down for a period of 7 days. Is that an accurate statement? The donor site is typically more painful than the recipient site. Doctor, is that not especially true during the first 24 to 48 hours? Well, usually it heals within 7 days. And new blood vessels, doctor, grow into the lower level of the graft within 4 to 7 days. Is that correct? To be protected from pressure and movement? Well, I would say especially shear forces. For example, when one part of the body, such as the arm, rubs against another part of the body, such as the chest wall. Doctor, when you start to slowly mobilize, the graft will be protected, will it not? Well, that may be. And nerve endings grow into the graft 2 to 4 weeks after placement. Is that not true? When some feeling may start to return, yes. Hair follicles transplanted from the donor site may grow on a full-thickness graft, but a split-skin graft remains hairless. Doctor, is it not true that both the recipient and the donor site are disturbed as little as possible during the operation? That is a correct statement. And they are typically, doctor, redressed after 1 week. The skin graft must be protected from trauma for 2 to 3 weeks. Avoid strenuous exercise and lifting depending on the site and size of the graft. Doctor, your occupation is important also, that is, the patient's occupation? Yes, you may be able to return to work within a few days of surgery, however. If grafting is extensive or is on your lower leg, however, you may have to stay in the hospital or off work for several weeks. Doctor, is it not true that a split skin graft needs regular moisturizing as it does not contain oil or sweat glands? That is true. And you also should let your doctor know if you develop a fever? Yes. Or if you develop increasing pain, swelling, redness, or warmth at the donor or recipient sites? That is correct. You experience excessive pain that is not helped with medication. Doctor, you develop bleeding or a smelly discharge at the donor or recipient site. Is that not a fact? Yes, that is a fact. And does an adenoidectomy affect it? Well, I don't know what the relevance of that is. What is an adenoidectomy? An adenoidectomy is a surgical removal of the adenoids commonly performed along with tonsillectomy. Okay.